Tired of politicians offering absurd, dumbed-down solutions for fixing our ailing healthcare system? Here are 3 limits of the models offered to fix healthcare. First, the limited role of insurance. Insurance is a hedge against unforeseen events. If you can anticipate needing it for a particular event, then insurance doesn't really apply. Well, think of this example. Car insurance is there largely in the case of an accident. It's already pretty expensive for a lot of people, but imagine how much more expensive it would be if it didn't just pay for accidents, but paid for oil changes, tire rotations, new headlights, brake pads, windshield wipers, and more. It would be astronomically more expensive because these are anticipated needs for every car. As a human, you can anticipate needing checkups, periodic tests and screenings, and then the inevitable treatment for minor cuts and scrapes, minor infections of all shapes and sizes. Insurance is not a tool built to take care of these everyday needs. Because we have something the government mandates that it calls insurance, but isn't really insurance at all, we are set up with an untenable system. And as science discovers more treatments for things that in previous generations we would have dealt with, ailments that will take care of us like never before, it's only going to get worse. There is a limit to the role insurance can play in any healthcare system. Next, the limited role of the free market. No matter how you feel about the free market in general, the value proposition is that it offers the highest quality goods and services to the largest number of people for the lowest possible cost. Now, we don't really have a free market system in healthcare in the United States at all, for reasons we can discuss in another video. For our discussion, even if we did, the free market has a very limited role in healthcare. Why? Well, for a free market to work, you must have some sort of real choice. When you suffer from catastrophic illness or injury, you seldom have real choices in a market at all. If you get hit by a train, you aren't in a position from the back of a speeding ambulance to coolly compare the hospital services and their prices to save your life. There's a limit to the role a free market can play in healthcare. Lastly, the limited role of government. No matter how you feel about the role government should be playing in access to medical care, the value proposition is that it can guarantee a right to life-saving care regardless of your ability to pay. There's a lot to be said for that. However, today in the United States, we have the best access to timely diagnostic tests and procedures than anywhere on the planet. Survival rates for cancer and other catastrophic ailments are better than most countries with full government guarantees. Now, nobody wants to go broke just to keep from dying, but I think most would prefer to stay alive. So can we have both the best medical care and affordable access to it? Of course that's the goal, but if we want to continue to have the most pioneering, state-of-the-art medical advancements and speedy access to care, we cannot just hand it all over to government. There's a limit to the role government can play in any healthcare system. Here's the good news. When we recognize the limits of insurance, the free market, and government in any healthcare system, we can stop trying to fit round pegs in square holes and create a uniquely American system with the tools that we have available. What do you think? Let us know in the comments. If you can be kind and you can be curious, you can be in the comments.